Today we'll be discussing the regressive alterations of teeth. The three main ones covered here are attrition, abrasion and erosion. Regressive changes in the dental tissues include a variety of alterations that are not necessarily related. Some of the changes are associated with the general aging process of the individual, whereas others arise as a result of injury to the tissues. The common ground is that there is loss of dental tissue, that is enamel and dentine. The first one that we'll be discussing is attrition. Attrition occurs as a result of tooth-to-tooth contact, for example during mastication. As the person becomes older, this wear continues. Attrition starts off as a small polished facet on a cusp tip and may lead to gradual reduction in the cusp height and flattening of the occlusal inclined planes. This shows us that this process is not pathological but more physiological. In the cases of advanced attrition, the enamel will be completely worn away in a few areas, resulting in extrinsic yellow or brown staining of the exposed dentine. Attrition is also very useful in age estimation techniques that are used in forensic odontology. On the other hand, abrasion is the pathological wearing away of tooth substance through some abnormal mechanical process. This can be due to the use of an abrasive dentifrice or faulty toothbrushing techniques, or also due to occupational hazards such as in the case of carpenters, shoemakers, etc. As shown in this specimen, abrasion is usually seen on the incisal, proximal or exposed root surfaces in the form of a V-shaped notch. Lastly, we have erosion, which is mainly due to contact with acidic media, and this does not involve bacteria. This is a chemical process which can have extrinsic as well as intrinsic causes. When the acid source is extrinsic, that is due to the consumption of acidic beverages, food or medications, or when the source of the acid is from inside the body, that is during gastroesophageal reflux disorder, anorexia, bulimia, etc. It's seen in the form of incisal grooving or occlusal cupping. The first step in treating any regressive alteration is finding the etiology. For example, in the cases of erosion, referral to a physician in cases of GERD, or for psychological counseling in the case of anorexia, reduction in alcohol intake in case of erosion associated with alcoholism, or any kind of occupational therapy, etc. may be required. Treatment itself includes dentine desensitization using fluoride varnish, dentine bonding agents, desensitizing toothpaste, etc. Restorations in endodontic therapy may be given, for example, glass enomer and composite restorations, or endodontic therapy in case of pulpal involvement. Periodontal therapy may be required in cases of gingival recession. Patient education is of paramount importance. Thank you.